Bell's palsy. Bell's palsy is a condition that causes sudden weakness in the muscles on one side of the face. In most cases, the weakness is temporary, significantly improves over weeks. Bell's palsy is also known as acute peripheral facial palsy of unknown cause. It can occur at any age. Next, moving on to symptoms. Rapid onset of mild weakness to total paralysis on one side of the face occurring within 2 days. Facial droop and difficulty making facial expressions such as closing eyes and smiling. Drooling. Increased sensitivity to sound on affected side. Pain around the jaw or in or behind the ear on the affected side. Headache. A loss of taste. Changes in the amount of tears and saliva production. Here on the right side there is a wrinkles on the forehead, but here there is no wrinkles on the forehead. Flattening of the wrinkle lines on the forehead. This is an important feature. So there is no facial muscle expression. Next, widening of the opening between the eyelids, and here there is no fold of above the lips. Here there is folding, but here there is no folding. And here drooping of the corner of the mouth. So Bell's palsy is also known as mask-like face. So there is no any facial expression. Causes. Exact reason is not known. It is an infranuclear lesion in the facial nerve. It is very important. That is infranuclear lesion in facial nerve. Viruses are also cause Bell's palsy, that is herpes simplex, chickenpox virus, Epstein-Barr virus, cytomegalovirus, adenovirus, rubella, mumps, Coxsackie virus, like that. Next, moving on to risk factors. Pregnancy. In pregnancy, 3rd trimester or first week after giving birth. These are the pregnant women are most risk for Bell's palsy. Then upper respiratory infection, diabetes, hypertension and obesity. Complications. Irreversible damage to the facial nerve. Irregular regrowth of nerve fibers. Partial or complete blindness of the eye that won't close. Diagnosis. In Bell's palsy, in recurrent attacks are rare, but if they occur regularly, it mostly due to the family history. In diagnosis, clinical findings, that is physician usually asks to the patient, close your eyes, lifting your eyebrows, showing your teeth, that likes. If they are not able to closing their eyes and lifting their eyebrows, mostly it is due to the Bell's palsy. And next diagnostic feature is electromyography. It can confirm the nerve damage and it's determine the severity of the nerve damage. Electromyography measures the electrical activity a muscle in the response to stimulation. It also measures the nature and speed of the conduction of electrical impulses along a nerve. Next, imaging scans, that is MRI and CT scan. It is rule out the presence of facial nerve. Pressure on the facial nerve. It rules out pressure on the facial nerve due to any tumor or skull fracture, something like that. Next, moving on to blood test. Here there is no specific blood specification for Bell's palsy, but it ruled out Lyme disease and other infections. Next, moving on to treatment. In treatment, mainly using lubricants for eyes because eyes are dry. So using lubricants for eyes, keep moist your eyes and wearing glasses. These are the general aspects. Medications. In medications, corticosteroids and antiviral drugs are used. Corticosteroids, it's very important, that is anti-inflammatory. These are the anti-inflammatory agents. It reduces the swelling of the facial nerve. In antiviral drugs, They have no benefits in Bell's palsy. It is still unproved. It uses like as a placebo. Next, physical therapy. It gives massage and exercise on the facial muscles. Next, surgery. Decompression surgery. Relieve pressure on the facial nerve. It is not recommended today because of the facial nerve injury. Permanent hearing loss and risking the injury of the facial nerve. So it is not recommended now. Rarely plastic surgery is needed. Facial reanimation surgery is used in this condition, that is eyebrow lifting, eyelid lifting, facial implants and nerve grafts, something like that.